In January of 2026, over 7 million disabled Americans opened a letter from the Social Security Administration. It said their benefits were going up, a 2.8% cost of living adjustment, $44 more per month, $528 more per year. That was the promise. But here is what that letter did not say. By the time the government was done taking its cut, most disabled workers would see barely $26 of that raise, and even that would be eaten alive before the month was over. This is the story of how the system gives you a raise with one hand and takes it back with the other. And if you are living on disability right now, you already know exactly what I am talking about. Let us start with the basic math, because the numbers tell the real story. The average disabled worker in America received $1,586 per month in 2025. After the 2.8% cost of living adjustment, that number went up to $1,630. That is a $44 increase. Sounds like progress, right? But here's what happened next. Medicare Part B premiums jumped from $185 a month in 2025 to $202.90 in 2026. That is a $17.90 increase pulled directly out of your disability check before you ever see it. So that $44 raise just became $26.10. That is not even $1 a day. Now let us talk about where that $26 actually goes. According to the United States Department of Agriculture, overall food prices are projected to rise 3.6% in 2026. But that average hides some brutal specifics. Beef and veal prices jumped over 14% higher in February 2026 compared to the year before. Sugar and sweets are forecast to rise 6.7% this year. Non-alcoholic beverages like coffee and juice are expected to climb 5.2%. And here is the part that gets overlooked. The cost of living adjustment is calculated using price data from the third quarter of 2024 through the third quarter of 2025. By the time your raise actually hits in January 2026, prices have already moved past what the raise was designed to cover. You are always playing catch-up. Always 1 year behind the real cost of staying alive. And food is just the beginning. The average rent in the United States hit $1,843 per month in March of 2026. That is 3.6% higher than the same time last year. Think about that number for a moment. The average disabled worker brings home $1,630 a month. The average rent in this country is $213 more than the entire disability check. Even in lower-cost states, rent eats 50 to 70% of a disability payment. That leaves a few $100s for food, medicine, transportation, utilities, and everything else it takes to survive. And that is before a single unexpected expense, a broken wheelchair part, a copay on a new medication, a utility bill that spikes in the summer or winter. There is no margin. There is no cushion. There is just math that does not work. Here is something most people outside the disability community do not understand. Being disabled is expensive in ways that never show up on a government spreadsheet. A standard manual wheelchair costs between $500 and $2,000. A power wheelchair runs anywhere from $15,000 to over $30,000. Home modifications like ramp installations or accessible bathrooms can cost $10,000 or more. Specialized transportation, accessible clothing, medical supplies that insurance does not fully cover. These are not luxuries. These are the base costs of existing with a disability. And none of these costs are factored into the cost of living adjustment formula. The Consumer Price Index for urban wage earners and clerical workers, the CPIW, tracks spending patterns of working urban households, not disabled households, not people who spend a disproportionate amount of their income on healthcare and adaptive equipment. The formula was never designed for the people who need it most. Now here is where it gets even more complicated. If you are on SSDI and you try to work, even part-time, to supplement that $26 raise, you enter a minefield of rules that can cost you everything. The substantial gainful activity limit for 2026 is $1,690 per month. Earn more than that, and the Social Security Administration can decide you are no longer disabled. Your benefits stop. Your Medicare coverage, which you waited 24 months to get in the first place, goes on a countdown. You get a trial work period of 9 months where you can test your ability to work. In 2026, any month you earn more than $1,210 counts as a trial work month. Use all 9 months and you enter an extended period of eligibility where going over the SGA limit in any month can trigger an immediate benefit cutoff. If you are watching this right now and you want to see more content like this that actually breaks down how the system works for people with disabilities, take a second and hit that subscribe button. This channel exists because these stories deserve to be told honestly. Let us talk about healthcare, because this is where the $26 raise completely evaporates. SSDI recipients become eligible for Medicare after a 24-month waiting period from the start of their benefits. 2 full years with a qualifying disability before federal health insurance kicks in. Once you have Medicare, Part B covers doctor visits and outpatient services, but the premium for Part B in 2026 is $202.90 per month, and that comes straight out of your check. Part D, which covers prescription drugs, is an additional cost. Medigap supplemental policies, which fill the coverage holes in traditional Medicare, are going up too. And none of this accounts for what Medicare does not cover at all: dental care, vision care, hearing aids, long-term care. The things that disabled people often need most are exactly the things Medicare was not designed to pay for. Here is a number that should make everyone pay attention. According to a report from the Joint Center for Housing Studies at Harvard, 22.7 million renter households in the United States are cost-burdened, meaning they spend more than 30% of their income on housing. That was a record high in 2024. Among those, 12.1 million renters, 26% of all renter households, are severely cost-burdened, spending more than half of their income on rent and utilities. Now imagine being in that group while also living on a disability check of $1,630. And imagine the government telling you they just gave you a raise, $44, minus $17.90 for Medicare, leaving you $26.10 to fight 3.6% food inflation, rising utility costs, and a housing market that was never built for people on fixed incomes. And here's the part that rarely gets discussed. The way the cost of living adjustment is calculated almost guarantees it will never keep up. The COLA is based on the Consumer Price Index for urban wage earners and clerical workers. That index tracks spending by approximately 30% of urban consumers who earn blue-collar or comparable wages. It does not track spending by disabled Americans. It does not track spending by retirees. It does not track the specific categories where costs hit fixed-income households hardest, like medical care, accessible housing, and specialized transportation. The Bureau of Labor Statistics does publish an experimental index called the CPIE, which tracks spending patterns of Americans 62 and older. That index consistently shows higher inflation than the CPIW because older and disabled Americans spend proportionately more on healthcare. But the CPIE is not used to calculate the COLA. It remains experimental. Year after year, the raise is calculated using a formula that measures someone else's cost of living. So what does all of this actually mean in real terms? It means that in 2026, the maximum SSDI benefit is $4,152 per month. But that is only for workers who had high lifetime earnings. Most disabled workers will never come close to that number. The average is $1,630. For SSI recipients, the situation is even more stark. The federal benefit rate for an eligible individual is $994 per month. For a couple, it is $1,491. That is $11,929 per year for an individual on SSI. The federal poverty line for a single person in 2025 was $15,060. That means SSI benefits, by design, keep people below the poverty line. This is not a glitch. This is the architecture of the program. And a 2.8% adjustment does not change that architecture. It just makes the gap slightly less visible. There are things the system does not want you to know, because knowing them means asking harder questions. Most people do not know that SSDI has a trial work period that lets you test employment without immediately losing benefits. Most people do not know about ABLE accounts, tax advantage savings accounts for people with disabilities that do not count against SSI resource limits. Most people do not know about the Ticket to Work program, which provides free employment support services. Most people do not know about the Plan to Achieve Self-Support, which lets you set aside income and resources for a work goal without it reducing your SSI. These programs exist, but they are buried in bureaucratic language and scattered across different agencies. The system does not make it easy to find the tools that could actually help. And when your entire financial life is built on a check that barely covers rent, you do not have the luxury of spending weeks navigating government websites to find a program that might help you save $50 a month. $44. That was the headline. That was what the letter said. But the truth is $26.10 after Medicare. And the truth after groceries, rent, utilities, and the invisible costs of disability is that most people on SSDI ended 2025 with less purchasing power than they started with. And 2026 is not going to be any different. The cost of living adjustment was never designed to lift anyone up. It was designed to slow down how fast you fall behind. And for 7 million disabled Americans, falling behind is not a metaphor. It is the math of every single month. If this video opened your eyes to something you did not know, share it with someone who needs to hear it, and drop a comment below. I want to know, what does the real cost of living on disability look like in your life? Because these numbers are national averages. Your story is the one that matters.